So my name is Abigail Johnston, and I graduated from law school in 2002, and I've been a licensed attorney in Florida ever since then. That all served me very well when I was diagnosed with stage 4 metastatic breast cancer in 2017. And I like to call myself a professional patient at this point because basically I go to the doctor and that's my job, as well as taking care of my kids and that sort of thing. So going from going to the doctor maybe once a year to probably having a doctor's appointment with some specialist once a week, it seems like sometimes, that was a really big adjustment. And then dealing with all of the stuff that came with that on a personal level, I started seeing so many of the things that are broken in our system and how hard it is to access care. The system, the healthcare system, whether you've got health insurance companies, your doctor's office, pharmaceutical companies, it is hopelessly confusing and hopelessly broken in so many ways that we need every advantage we can possibly find in order to navigate all of it. I think the thing that I've learned with all of this is that everything's negotiable. And if you need a particular test or a scan and your insurance company is not cooperating or your doctor is struggling to get things approved, calling up companies and asking for a reduced rate, asking for them to waive their fees, even if you have private insurance, asking for Medicare rates, because those are usually lower than health insurance, is able to negotiate. Medicare is negotiating on behalf of millions and millions and millions of people, so they can get better rates a lot of times. There's a lot of room to work with a company if you need a particular thing done. Another thing that I've noticed too is that when a particular medication or procedure is approved by the FDA, it can take a little while for that either medication or test to be added to the list at your insurance company. So it's called a formulary if it's a medication. So something is approved by the FDA, your insurance company, it probably won't be added to the formulary for a couple of months. And so sometimes that can create some delays for patients. Hey, this new medication just got approved by the FDA. I want to get on it right now. I've been waiting for it. Unfortunately, that can mean a bit longer of a delay just because it does take some time for health insurance companies to get all the information they need from the pharmaceutical companies into their formulary, figure out how much all the costs are, do all the negotiations. It can be a really complicated process. In that particular situation, that's where the foundations that are attached to the pharmaceutical companies can often get you a supply before they work out all those kinks. Yeah, absolutely. So every doctor, in order to get reimbursed for the things that they're doing, they have to use what's called a CPT code. And so every procedure or medication or time or anything they want to get reimbursed for, there's a code for that. And actually, there's been a recent controversy where some of the CPT codes changed, meaning that there's a particular surgery called the deep flap surgery that a lot of people who are getting mastectomies and reconstruction like to get. In the way that they change the reimbursement schedule, it means that doctors will probably no longer offer that surgery. And so a lot of people are very concerned about that right now. But there is a separate body, it's an administrative body that sets not only the CPT codes, but also recommended reimbursement rates. And so once that has been set, the coders in the doctor's office, you come in, you see your doctor, you get medication, whatever, they send a billing document, however they send it. Sometimes it's fax, sometimes it's electronic, who knows how each individual company wants to receive it. Then they have the CPT codes and they're billing for whatever procedure was done. Now, these coders or people who do billing are doing this all day long, right? So it happens all the time, right? These are human beings. They're selecting codes and hopefully it's correct. So especially for those of us who are having the same visit over and over and over again every month, the same blood work over and over and over again every month, saving those explanations of benefits that you get from your insurance company, you can spot trends. You can say, okay, this CPT code, 212.4, whatever, that is what they're billing for every single time. And so then if there's suddenly that billing for with a different CPT code, you can see, oh, that was something perhaps that they did correctly or incorrectly. First of all, every single doctor's office and medical practice is set up to do payment plans. And so if you need to spread out paying for your medical bills at, $20 a month or $5 a month, whatever the payment plan that you are able to afford, doing that or setting that up in advance is always better than getting a call from a collection agency, right? So you know what you can do. You talk to your doctor's office and say, how can we do this? How can we set up a payment plan? And then, you're meeting an out-of-pocket maximum by spreading out those payments. I have not heard of any medical practice that won't waive interest if you're consistent with your payment plan. And I would ask that if they would waive interest, so it's not like you're financing a debt, it's just you're on a payment plan until you pay it down. So having that conversation with the billing person, with the financial aid person, whoever that is in your doctor's office or your cancer center, that would be kind of the third step or the third possibility. Most, if not all, cancer centers will have a financial aid office, or sometimes it's run through a chaplain's office or benevolent office, something like that. And so just like pharmaceutical companies all have a foundation attached to them, just about every major cancer center has a foundation attached to them. Now, a private doctor in a private practice may not have a foundation, but you can bet, and it's a sure bet, that they've worked with people who have financial struggles because of medical treatment. And so approaching them upfront and saying, look, this is going to be an issue, and working out a plan is one of the best possible things you can do. Additionally, if there's a social worker in the office, your doctor's office, or in the cancer center, social workers are the ones who have usually the most information on whatever local organizations provide financial assistance for patients, and there are lots of them. So social workers are a great point of contact. Sometimes you're a nurse navigator, sometimes we'll have some of that information as well. But starting with the place that you receive your medical care from and working with them on how to meet those bills, that would be kind of the third step or the next step that I would suggest making. And then there are all of those organizations that have various funds. So the American Cancer Society has a fund. And if you get on their mailing list, then you find out when that fund opens. And a lot of times there are many different funds. Some will be specific to, say, people of color, or specific to people with MBC, or specific to moms, or whatever the particular circumstances are. Getting on those mailing lists so that you know when there is a fund opening. Living Beyond Breast Cancer also has various funds. Also, some focused on MBC, some focused on young women, etc. Universally, what happens with these funds is that they open and they close pretty quickly because everybody's waiting for them to open so that they can apply. I know the Susan G. Komen organization also has some funds available. There's a wonderful organization in the Northeast called Infinite Strength that specifically focuses on financial support for single moms with metastatic breast cancer. You have to have a child under 18 in the home. The Cancer Couch typically just funds research. That's another place where people will raise money. There is a couple of other organizations that will fund very specific things. Will fund, say, just medical costs or just your, say, mortgage, utilities, etc. There's something called the Pink Fund out of Michigan that's pretty much funded by the Ford Corporation. They also provide funding. Every single one of these organizations has an application process, and most are related to the household income. So they focus on the people at, say 100% or 400% of the poverty level seems to be the range that I see. So, and then there's other places where, you say I have this diagnosis and they give you a gift card or they give you $100 whenever their funds open. So the long and short of it is there's no place, unfortunately, where all of this information is kept. Most people who are in this situation are, looking at every different possibility. Some social workers will be a really good contact for that. But at the end of the day, cancer is expensive. And financial toxicity is real because there's only so much money to go around. And so one thing that is, I think, very important for everybody to know is that you as a consumer are protected by the Fair Debt Collection Act. That is a federal act that if you are being called, i.e. harassed, by a collection agency or even by your medical office, if you say, I dispute this debt, I do not owe this debt for whatever reason, you don't even have to give a reason, they're no longer allowed to call you, harass you, send you letters. They have to stop or they incur fines. The only thing that they can do at that point is file a collection lawsuit against you, which is something that most are not going to do unless it's a large amount of money. And so don't just keep taking the harassment. If you're being harassed and you legitimately cannot pay a bill, simply explain, I don't agree with this bill. I don't agree that I owe this. Please stop calling me. And they have to stop. They have to stop harassing you. Way down the line, bankruptcy is an option. I think I saw a statistic that over 60% of bankruptcies in the United States are filed because of medical debt. And that is probably one of the big reasons why most medical offices, cancer centers, et cetera, will enter into payment plans with people, because they know if they don't, they're going to get nothing. And something is better than nothing. So there's a lot of options and a lot of different possibilities. The one thing they cannot do is refuse to provide you care. So if you are going to a cancer center and you have bills, they may put some pressure on you to pay them when you go, but they can't refuse care based on a bill that is pending. The other thing that I always recommend, if you're going to be talking to insurance companies, your doctor's office, drug companies, whoever you're talking to, have a notebook. I have a notebook that sits beside my computer, and I'm immediately writing down date, time, who I talked to, and what happened. I always ask for confirmation numbers, whatever can get them back to whatever discussion that I had, because I don't know about anybody else, but once chemo brain happens, there are just things that don't stick anymore. Unfortunately, it's one of the most confusing parts of things, because you have things like, and it says what happened to my mom. She went in for chemotherapy. They walk out and they're like, you owe us 40 grand, or you can't get chemotherapy. Oh, but by the way, if you would cross the street, you'll pay $50 out of pocket. And thank God they said that versus just accept it, because my dad was like, okay, take a credit card. Like, fine, I'll pay. But the piece that a lot of people don't understand is that the prices for a medication change based on how you get it, right? So oral, like a pill, an injection, or an infusion, right? It's the same medication, but it's billed different ways. And then it'll be billed different whether you get it in a doctor's office, in an outpatient center, in the hospital, outpatient at the hospital, inpatient in the hospital. Like, that piece is insane, because there's no way any patient could ever know those things except by shopping, basically. Or if there's a social worker who's very aware of that, like in the situation with my mom, they were like, just walk across the street. So, and I don't, yes, it's a business, but I do find that most of the staff, they really want to find a solution for the patient. But sometimes it's just hopelessly confusing. So there is a bill pending called the Cancer Drug Parity Act that would streamline that for the patient. You pay the same no matter how you get your medicine, no matter where you are. But I don't know that it'll ever pass, because it would affect, millions of contracts that are being made all the time between all of these different entities. Then the Cures Act, part of that was to say that when you get a scan, as soon as the doctor gets it, you have to get it at the same time. And that's usually pushed out in a patient portal. But the other piece that I believe it was that one, that act also required, is that medical practices have to be upfront as far as what they're charging. And so typically, so like when I walk into an urgent care center, there's like a poster, and it's like, this is what you'll pay if you have insurance, this is what you pay if you're paying cash. Um, Usually what happens if you're having a procedure or if you're getting some kind of medication, they will print off the, it's like an estimate, like when you get your car fixed, like they'll give you an estimate as far as what it will probably cost. And so that is something that is now required. Hospitals and doctors' offices are required now to be more transparent about those things. But if that is something, if the cost of something, especially if it's not covered by your insurance policy, or you're going to have to pay some out of pocket, or you haven't met your deductible or your out of pocket maximum, and you need to have a payment plan, these are all things that are good to just ask about up front and sit down with the financial person in whatever place you are to work out a plan.